Nursing assessment stations are a vital part of nursing education and clinical practice. These stations are simulated scenarios where nursing students and practicing nurses can demonstrate their assessment skills in a controlled environment. They typically involve a standardized patient who is an individual trained to portray a specific medical condition. The nurse is tasked with performing a comprehensive assessment of the patient, gathering subjective and objective data to formulate a nursing diagnosis and plan of care. Assessment stations may focus on a variety of areas, such as medical surgical nursing, pediatric nursing, or mental health nursing. They may also focus on specific skills, such as wound care, medication administration, or emergency response. The scenarios are designed to be as realistic as possible, often utilizing medical equipment and props to enhance the simulation. Assessment stations serve a critical role in nursing education and professional development for several reasons. Firstly, they provide a safe and controlled environment for nurses to practice and refine their assessment skills without the risk of harming a real patient. This allows nurses to build confidence in their abilities and identify areas where they may need further improvement. Secondly, assessment stations provide opportunities for nurses to receive immediate feedback from instructors or peers. This feedback is essential for identifying strengths and weaknesses and for developing strategies to improve performance. The use of standardized patients also allows for consistent and objective assessments, ensuring that all nurses are evaluated against the same criteria. To excel in nursing assessment stations, nurses need to possess a strong foundation in several key areas. These include a thorough understanding of anatomy and physiology, as well as pathophysiology. Knowledge of these areas allows the nurse to interpret the patient's symptoms and identify potential medical conditions. Strong communication skills are also crucial for effective nursing assessment. Nurses must be able to communicate effectively with the patient to obtain a comprehensive health history and to explain procedures and findings in a clear and concise manner. They must also be able to communicate effectively with other healthcare professionals, such as physicians and pharmacists, to relay patient information and coordinate care. There are several tips and best practices that nurses can follow to enhance their performance in assessment stations. Firstly, it is essential to be well prepared. This includes reviewing relevant course material, familiarizing oneself with the specific scenario being presented, and gathering any necessary equipment beforehand. During the assessment itself, it is important to maintain a professional demeanor and to treat the standardized patient with respect and empathy. This includes introducing oneself, explaining the purpose of the assessment, and obtaining consent before proceeding. It is also important to maintain patient privacy and confidentiality throughout the encounter.